TGIF, good morning. Dr. PK here from DrPKLyfe. I hope you guys are doing well and ready for weekend. This video is part of series called Your Question, My Answer. So somebody journey with lupus responded to the video about lupus, which I had posted several weeks ago. So this is the question. Thanks for the detailed information clip. Just wanted to clarify that an anti-dsDNA suggests involvement of kidney despite urine blood tests that are clear? Question mark. Also have few questions. Number one, for a diagnosis of SLE, besides full blood test, what are other labs that should be done to monitor trends regularly? Question mark. Do these lab test number indicate higher or lower activity? Question mark. Number two, for mild lupus cases, can it be managed without medication? Question mark. So here's my answer. Thank you for asking very thoughtful and clinically relevant question. I'm glad you asked. So I'm going to break it down very clearly and systematically. Does anti-dsDNA suggest kidney involvement if urine tests are normal? Short answer, not necessarily. So let's go over the test again. What anti-dsDNA means? Anti-double-stranded DNA antibodies are specific for lupus. That's for certain. Higher level often correlate with disease activity, higher disease activity. They are particularly associated with lupus nephritis. However, if urine analysis is normal, no protein, no blood, no cast, creatinine is stable, C3 and C4 are normal, then there is no evidence of active kidney damage at that time. Anti-dsDNA can rise before kidney involvement, but it does not automatically mean kidney damage is happening. Think of it as a risk signal, not proof of injury. Number two, what lab should be monitored regularly in lupus? Here's a practical monitoring moving forward. So this is close monitoring of labs. We do every three months or even every 6 months in a stable patient. CBC, it tells you about anemia, low platelets, and leukopenia. We check for electrolyte, which is basically comprehensive metabolic panel we check. Some people even check basic metabolic panel, but we have to check for kidney function, that is BUN and creatinine. Urine analysis, we check for protein and blood. We check urine, protein, and creatinine ratio because that indicates early kidney injury. Anti-dsDNA, that will tell you disease activity trend. And C3, C4 will tell you also disease activity trend because complement levels are consumed when disease are active. So what indicates higher activity? Rising anti-dsDNA, falling C3, C4 complement level, new protein in urine, and drop in blood count. Trend matters more than single value. Do higher numbers mean more active lupus? Generally, higher anti-dsDNA means more immune activation. Lower C3-4, that means more complement consumption, that is equal to more activity. But lab values must match symptoms and exam findings. We treat patient, not just the number. Can mild lupus be managed without medication? This depends on the organ involvement. The truly mild lupus, just the skin rash only, and just arthralgia without any joint damage, and labs are stable. Sometimes they're just managed with anti-inflammatory diet or anti-inflammatory medication, vitamin D optimization, sun protection, and stress control, and better sleep and close monitoring. But most of the time, rheumatologists still recommend Plaquenil, hydroxychloroquine, even in mild cases, because it reduces flare, it protects kidney in long term, it lowers clot risk, it improves survival, it's generally very safe. So, no medication is uncommon in long-term treatment of confirmed SLE. What causes positive anti-dsDNA beside lupus? High titer double-stranded DNA, more than 3 times upper limit, is strongly suggestive of lupus, but rare cases of other autoimmune diseases can happen, chronic infection, there may be lab assay variability, sometimes there could be drug-induced autoimmunity, like hydroxychloroquine, a nuclear DNA pattern, however, is more often seen in scleroderma, spectrum disorder, mixed connective tissue disorder. That combination deserves thoughtful rheumatology follow-up, not dismissal. When you should worry about it, you got to seek urgent evaluation if you have lupus. If a foamy urine, swelling in legs and around your eyes, persistent high blood pressure, severe fatigue, new neurological symptoms. Bottom line, anti-dsDNA alone does not equal kidney damage. Trend monitoring is critical. Complements blood urine tests matter greatly. Hydroxychloroquine is usually protective even in mild disease. High titer should not be ignored but should be interpreted in context. So thank you for watching TGIF. If you like my video, please share it and repost them, and have a great weekend. Thank you for watching.